Now, here is your stem.
Yes, ma'am.
Okay, so if you've read and understood considering each surgical pathology station, please tell me what you understand by the term diverticulitis.
Diverticulitis means when there is inflammation in presence of diverticula in the colon, most commonly in the sigmoid colon, there is diverticulitis.
Okay, what is the pathogenesis in this condition?
Here, it occurs due to the unique structure of the muscular structure of colon, along with when it gets vulnerable due to increased intramenal pressure of the colon, then diverticulitis may occur. In case of colon, the diverticular may be congenital or acquired. And it occurs due to the unique structure of the muscular scopia of colon. That's mainly the inner layer, inner circular layer of the muscular scopia. There are a certain discontinuity over the muscular scopia due to the penetration of the nerves and vascular bundle and connective tissue system. In other parts of the intestine, this gets reinforced by the outer longitudinal muscular scopia layer. But in colon, the outer layer is gathered into longitudinal structure called the coli. That's why through this weakness, the mucosal layer along with the thin layer submucous tissue gets protruded and diverticular.
Okay, what are the complications that can result if this condition remains untreated?
Complications like obstruction, diverticulitis, infection, perforation, bleeding, fistula formation, peripheric abscess, focal peritonitis, generalized purulent peritonitis. These are the common complications.
Okay, please tell me what are the investigations that one can carry out in order to establish diagnosis?
Investigations I can do first common full blood count, blood labs, then an abdominal X-ray, clean abdominal X-ray, chest X-ray, urine and RNA, routine microscopic examination, and CT scanning selected cases, and CT scan of abdomen, barium followed barium enema, and rigid sigmoidoscopy. Those
Okay, please tell me how many theories are you aware of which can explain the process of endometriosis in a patient who has diverticulitis?
There are four theories. First, regurgitation theory, that is the retrograde menstruation that's commonly happen in normal individuals. Retrograde menstruation can occur to the fallopian tube, and endometrial tissue may spread to the peritoneal cavity. This is one theory. Then benign metastasis is another theory where endometrial tissue can penetrate the blood vessels and lymphatic and get spread to the distal side, and like bone, lungs, brain, and other theories like metaplastic theory. In that case, endometrial develops by metaplasia from the coelomic epithelium, which has its common origin, and mesonephric tissue may also get differentiated into endometrial tissue. Another theory is extrauterine stem cell theory, progenitor stem theory, where stem cells from bone marrow gets differentiated into endometrial tissue.
Out of all these, can you tell me how does the endometriosis gets into the colon?
Endometriosis, endometrial tissue from the peritoneal cavity may get attached with that colonic outer layer of colon, and if diverticular disease is also present, there may be perforation, and that may necessitate.
Okay, for the sake of management, you would have to classify diverticulitis. Can you tell me how would you classify it?
Yes, there is a Hinchi grading system for diverticulitis. Grade 1 is peripheral abscess formation. Grade 2 A is the distant collection,
No,
which
pelvic
is amenable,
abscess.
distant collection, which is amenable to partner drainage. And 2B is the distant collection, complex collection, that is associated with fistula, and that's not available for partner drainage. And grade 3 is generalized peritonitis, and 4 is fecal peritonitis.
Okay, what is the management that you can offer this patient in the STEM? After Hartmann's procedure has been done, and now you've learned about the histology report of the patient, what more can be done to manage this patient?
To manage this patient, uh, 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 Hartmann procedure is one of the
Yes,
surgical management of diverticular disease.
yes, that has been done. What else can you suggest in addition to that?
And for further prevention of complication, I will ask patient to change lifestyle, like a fiber-rich diet intake, and that will include the stool bath, and in case of Hartmann procedure, as it's a stage procedure, I will reverse I will restore the gut continuity later on, most probably after 3 months. And
Okay, please tell me, considering or after having a look at patient's histopathology report, a patient who has diverticulitis and with endometriosis, what would be the long-term risk that you would think of?
in patients with endometriosis, there is increased risk of ovarian carcinoma.
Yes.
So the patient need
All
to be
right. Please tell me, where is my stem? Yes. If you could have a look at the images and help me to read this.
This is the histopathologic microscopic picture of
Yes, two structures. Under this one, there is a label here, but below this one, there is no label. So this is uterine and this is gastroenteral. So please, what difference do you see?
there's clear demarcation of the normal tissue and the dark inflamed tissue, just like the necrotic.
No,
And
not necrotic. This is
on the right side,
endometriosis you're looking at.
okay, this is the wall of the colon. That that dark colored endometrial tissue is visible. And on the right side picture, the lumen is obstructed by most likely internal content.
These are the endometriosis. And what are you looking at here? This one or here? This is the hepatic cell, but here is the dark blue, black, burnt powder chocolate cyst. So these are what endometriosal cyst, you could say. Okay.
I will say that colonic wall showing endometrial tissue along with chocolate cyst.
Yes. Okay. Thank you.